Good morning, everybody. What a beautiful day. We're hoping today's the day before the weekend begins, but we're in a great city. Great things are going on, and we're enjoying the world. The Heat's doing well. So we're going well, and I don't know how the Panthers game ended. But today, I want to talk about this lovely lady. It's a hyper irrational desire. I have all sorts of books on Dolly that tells about it, and we looked it up online, and there was nothing online, but this is made of blue mauve glass paste and gold-plated bronze. But only Dolly could come up with the headpiece that fits in here with a head that goes on the top. Who knows what it is, but Dolly is such a crazy individual, and him and Dom in the 50s put together these different pieces, and they're just incredible. And there were 300 pieces issued of them, and as I said, my favorite Dolly pieces are Dom. Dom glass is just magnificent. Just recently, a friend of mine did an estate sale and got a couple of fabulous Dom glass pieces that I got for a friend of mine, and boy, does he love them. But today, what are we going to talk about? The secondary effects of accidents. Hey, you fracture your leg or your ankle. You go to the orthopedist, he gets it set or he does surgery, and that's it. Not at affiliated healthcare. Why? Because people forget that there are secondary effects of accidents. What do you mean? I had a young lady going down the steps of a plane, fractured her ankle. She got something called complex regional pain syndrome, where her leg went dead, the left leg. It went up and affected her heart. And at age 22, I got her Social Security disability. Can you imagine? It's that permanent. That stays with her the rest of her life. And I really feel sorry for the young lady. But if I didn't pick it up, no one would have realized it. They thought, oh, it was just a heart condition, not realizing that it was a secondary effect of the accident. But that's what happens. And it's amazing, too, how things are affected and how it affects you. Also, too, on not only that, let's say there wasn't a CREPS, a complex regional pain syndrome, which used to be called reflex sympathetic dystrophy. They didn't check nerve damage. Why? Well, that's a secondary effect of the accident. That's where the nerve goes dead and the leg goes dead. But sometimes the leg doesn't go dead, but that nerve is affected and you've got severe nerve damage. And also, too, later in life, I had one of my dearest aunts fractured her ankle, and later in life, she limped and she used a cane because her foot never healed right, and it turned out. But that's what can happen and does happen. The same with a fracture in your leg. It doesn't heal correctly. Oh, yeah, but it healed. Doesn't mean it healed correctly. But of course, when you fracture it and the bones break, it can and does affect the nerve. So there is, in fact, secondary nerve damage. As well as the wrist, the elbow. Hey, people get in accidents. People think, oh, it's only the neck or the back or the knee or the shoulder or maybe the ankle. Well, that elbow's affected. You can get ulnar neuropathy. You can get so many different things that can and do affect it. And that's the difference in affiliate healthcare. Why? Because we want to treat those items to make sure it does not severely affect you later in life and affects the rest of your life. Plus, of course, if you have an attorney or there's a lawsuit, they want to know what kind of damage it is. That's why I love what we do, because we're there finding people's problems. That's what our job is, and that makes it easier for us to be able to treat them and to see what the effects are in the future. Also, there's something called PTSD, post-traumatic stress disorder. Well, the vets get that. Well, can I tell you something? I had a 3-year-old young girl, and the mother said, Dr. Burak, Every time I bring my daughter to the car, she starts screaming and yelling, and she doesn't want to go in the car. So I said, listen, our neuropsychologist, Dr. Robert K. Ludwig, I called him up and he says, Barry, let me take a look at the child. The child went in with the mother. Guess what? PTSD, post-traumatic stress disorder, on a 3-year-old child. Of course, the child had to get under therapy and to be taken care of. But that, if not taken care of, could have affected her the rest of her life and caused so much trauma ensuing because of it. Well, we at Affiliate Healthcare are looking to help people. And I'll tell you, that happens in adults a lot of times. It's a secondary effect, but it's something that's a horrible effect that can and does cause problems. And we're there at Affiliate Healthcare to help them. And that's why I love what I do. Affiliate Healthcare is the healthcare center with a heart. And remember that. We care. We're interested. Hey, my number's posted. I am always there to go and review and to help people for questions. I've got great doctors and chiropractors, but none of them have been doing this 44 years like me, and just spend that time in the evenings and the weekends going over their files to see what's going on, what's happening, and also when they want to come in and see me to see what's going on personally. I'm there. I'm an open book. More important, I love helping people. And that's what we do. I'm not going to say we can cure everybody and help everybody, but we usually can help everybody. Some people a lot, some a little, but it depends on the type of injury. But at least we're going to acknowledge their injuries, we're going to treat them, and so much of the time we can help them 80%. And that's pretty doggone good. But that's how we are at Affiliate Healthcare. The biggest problem is, of course, is getting people to address their injuries and to tell them to us. Doc, I got a little neck pain and it radiates into my shoulder. Hey, first thing we're going to do is we're going to do an MRI of the neck. Before that, we're going to do an exam of the neck, x-rays of the neck, and also double check that shoulder. Because a lot of times they don't realize it. Now, all of a sudden, they got to brush their hair, brush their teeth, lift things up. All of a sudden, it's a shoulder problem too. And that can start affecting that much more later on, whether it's a day, a week, a month, or 2 months. And the same with the back. You know, you injure your knee, but all of a sudden, what happens? That knee goes out because the back and the knee are connected. So if it's the knee first, it can affect the back. If it's the back, it can affect the knee. But when you're walking and you're sitting and you're ambulating, that's what happens. One thing can affect the other that causes it to go out of balance, out of alignment. And because you're walking on it, it can cause other problems. We've even had where people have needed surgery for 2 months. Hey, it was radiation. Now all of a sudden they start limping with the knee. That's when we do the MRI and we find the problems. And if we don't find those problems then, years from then, there's a severe problem, and that's when it could require a knee replacement. We don't want that to happen to anyone. This way we can treat it. And you also remember we do PRP, platelet-rich plasma, which Kobe, Dwayne Wade, Tiger Woods did in Germany before it was allowed in America. And they don't need surgery or replacement. And it helps in the healing factor. And that does it naturally. But at Affiliate Healthcare, that's what I love what we're doing. We're able to help people, treat people, and take care of people. And that's what we need to do. Also, I want to say hello to my good friend Renee Gim. Also, Michael Miller from Community Newspapers. Boy, we get great people watching this. Also, please, make sure that you refer it to your friends and family, please. People you know, put it on your site, because people don't realize there's people like me that are there to help them, that really care, that are interested, in their health, in their future. And that's why I love what we do. Remember, my cell number is 305-389-9513. The office is 305-666-83. We're located in South Miami, our main office. That's where we have our MRI, all our specialists, and our surgical suites where we do extremity surgeries. Also, we have an office in West Kendall, Homestead, Tavernier, and Pembroke Pines. Remember, we're there to help you and to take care of you. That's why I love what we're doing. Remember, we're always available. We're there to help you, your friends, your family, people you know, people you meet. People don't realize that there are places like us. And when you come to Affiliated Healthcare, you will find the most magnificent office with the most beautiful art and the most cordial, helpful, and caring people. That's why we're Affiliated Healthcare, the healthcare center with a heart. Everybody, please have a beautiful day. Enjoy yourself. Oh, and also, please remember, tonight, Legal Services, who provides free legal care to the community, is having their gala tonight. And I have donated 2 Salvador Dali lithographs for their auction so they can raise money to help that organization. Remember, we have to remember these groups that do help our community, and they're places like Legal Services. And they have many, many attorneys, many staff, and they do an outstanding job to help the people here in Dade County. Thank you for listening. Thank you for with us. Please again pass this to your friends and family and enjoy a beautiful day in South Florida. Thank you and bye now.